Hello and welcome to this online presentation hosted by Paramedical Services on allergy and anaphylaxis. This presentation is aimed at the level of the EMT. In this presentation, we're going to cover off the basics of the immune response, the pathophysiology of allergic reactions, what anaphylaxis is, and how to recognize the signs and symptoms of the mild to moderate and severe reactions, and then how to provide pre-hospital management of anaphylaxis, including the use of the Epipen. The immune system is a complex network of cells, tissues, and organs that all work together to protect the body from attacks from foreign substances and to prevent infection from occurring. The primary response team of our immune system are white blood cells. There's many different types of white blood cells within the body, and they can either live within the bloodstream, within the cells, or around the cells, and throughout the tissues. And when these white blood cells come into contact with any type of foreign substance that it thinks might be harmful, it can either have a direct attack on this foreign substance, which is called an antigen, or it can result in an inflammatory response, which tries to, again, eliminate this antigen or foreign substance from the body. And the inflammatory response is what results in the allergic reaction occurring, whether that be in the mild to moderate or severe form. Foreign substances can enter the body through ingestion, injection, inhalation, or absorption. Allergens that cause allergic reactions are usually harmless to the majority of people, but in a few individuals, the body has deemed these foreign substances as a threat and therefore result in an allergic reaction. These different types of allergens can include food, such as shellfish, nuts, strawberries, and kiwis, and there's a long list that follows on from this. Different types of medications, the most common ones being aspirin, antibiotics, and anesthetics. Insect stings and bites are also quite common at causing allergic reactions, and these can include stings from bees and wasps or bites from fire ants. Quite a number of people have allergic reactions to animal fur or dander, so their skin that flakes off, and that can include dogs, cats, horses, as well as a multitude of different animals. Pollens from plants and molds can also result in allergic reactions, as well as other materials such as latex. This is quite a common one in healthcare providers because of the repetitive use of latex gloves can cause mild reactions on the skin. This is just a short list of things that could cause allergic reactions. There are many more different causes, so it's important whenever we come across a patient who's having an allergic reaction to take a full history of anything that they've ingested, injected, inhaled, or anything that they might have come into contact with, which could be the possible culprit of the allergic reaction occurring. When an allergic reaction occurs, generally there is what's called an allergen sensitization. What this means is with the first exposure to some kind of foreign substance, the body's immune system recognizes this foreign substance as dangerous. Then it sends out messages to the white blood cells in the body to keep on high alert in case the substance re-enters again. And this is called an allergen sensitization. So it's when the body becomes sensitive to that particular substance. We're going to use the example of peanuts in this case. So if a patient picked up a handful of peanuts for the first time and ate them, once they had been ingested and absorbed by the body's systems, the white blood cells in the body would have come into contact with these peanuts and recognized them as a threat for some reason. And it warns the rest of the immune system that if this substance was to enter again, that it needs to attack it and eliminate it through a process of an inflammatory response. So once this initial sensitization has happened, then in order for an allergic reaction to occur, there needs to be a re-exposure of the substance. Once this allergen enters the body for a second time, so that person goes and eats peanuts, for example, for the second time, once those peanuts have been ingested and absorbed into the body's systems, it attaches onto the sensitized white blood cells in the body and releases chemicals such as histamine, which can cause either a localized reaction or a whole body reaction. The localized reaction is when we get that mild to moderate allergic reaction. And when the whole body is engaged in an allergic reaction, that's when we get the life-threatening condition called anaphylaxis. This chemical that is released by the body cells, called histamine, results in a number of different inflammatory responses. One of these is that it results in contraction of bronchial smooth muscles within the lungs. The processes that take place here are very similar to what occurs when somebody is having an asthma attack. So instead of the airways being nice and open and allowing good airflow all the way down into the alveoli, the bronchial smooth muscles constrict, so we get bronchial constriction and spasms. There's inflammation and swelling inside the bronchi, and there's also production of mucus there, just like in asthma, which dramatically decreases the amount of airflow into and out of the lungs. One of the other processes that takes place is vasodilation. If it's just a localized reaction, it happens just in the area that has been affected. Or if this is an anaphylactic reaction or a whole body reaction, this can happen all over the body. On the left-hand side over here in the pictures, we have a normal blood vessel, which is of a normal size. And once histamine attaches onto the blood vessel, it causes vasodilation. So the blood vessel expands in size, and the gaps between the cells in the blood vessel wall also get larger, which allows fluid to escape, leaking fluid from the bloodstream into the tissues, and that's what causes the swelling in the area. So this vasodilation can result in a decrease in the person's blood pressure, and it also causes swelling to occur because of fluid leaking out of the blood vessels and into the surrounding tissues. In the mild to moderate allergic reactions, which are also known as the localized allergic reactions, we can see signs and symptoms that cause a discomfort to the patient but are not life-threatening. This can include a runny nose, or what's known as rhinitis, itchy eyes, pruritus, which is itching of the skin, a skin rash or urticaria, which is also known as hives, edema, which is swelling, and abdominal pain or vomiting. However, it's important to note here is that if there's any abdominal pain and vomiting that's associated with an insect sting, this is no longer considered to be a mild or moderate reaction, but it's actually considered to be anaphylaxis, which is the whole body life-threatening allergic reaction. These life-threatening allergic reactions, called anaphylaxis, is a true medical emergency. This allergic reaction is a generalized whole body allergic reaction, which often involves more than one body system. It's characterized by rapidly developing airway, breathing, and circulation problems. The airway can swell shut very rapidly because of the excessive amounts of swelling in the oral cavity and in the windpipe. The patient can have severe respiratory issues from the bronchoconstriction in the lungs, and there will be circulation problems because of the massive vasodilation throughout the whole body and the extreme swelling that occurs. And because of this massive vasodilation and swelling that takes place, there's a dramatic drop in the person's blood pressure, and this results in an inadequate circulating blood volume, and that's why anaphylaxis is also known as anaphylactic shock. To explain this anaphylactic shock, we have a diagram below to depict what occurs with that histamine release. So if this is a normal blood vessel with the cells in the body and the skin is the yellow layer on top, when histamine is released, we have massive vasodilation around the whole body. So as the blood vessel dilates, the blood volume inside initially stays the same. Automatically, we have a drop in blood pressure when there's vasodilation. Then what happens on top of this process is, because of that vasodilation, the blood vessels become leaky, and the fluid that's within the blood, so our plasma, leaks out of the bloodstream into the surrounding tissues, which causes the swelling. So we have even a greater drop in our blood pressure. And this massive drop in blood pressure from the fluid leaking out and the vasodilation leads to shock because there's not enough blood volume to effectively circulate around the body. These are the different signs and symptoms that may be present in an anaphylactic reaction. Starting off with looking at the face, there can be swelling of the eyes, a runny nose, swelling of the lips, the tongue, and or the throat, which can become life-threatening very quickly as this can cause an upper airway obstruction. With the heart and the blood vessels, this can result in either a decreased heart rate or an accelerated heart rate and a low blood pressure, which leads to shock. When looking at the patient's skin, we may see hives, they might be feeling itchy, there could be swelling as well as flushing or mottled skin. The patient may be experiencing pelvic pain, loss of bladder control, and gastrointestinal signs and symptoms such as cramps, diarrhea, and vomiting. The respiratory system can be affected by causing shortness of breath, wheezing, or we may hear stridor, which is that high-pitched wheezing noise. There could be hoarseness in the person's voice because of the swelling taking place, and they could have pain with swallowing as well as coughing spasmodically. Then signs and symptoms that we might see associated with the central nervous system is lightheadedness and loss of consciousness, confusion, headache, and anxiety. This can also be a result of drop in blood pressure, but also because of possibly not getting enough oxygen into the system because of the effects on the airway and the breathing. It's important as medics that we are able to recognize which is the mild to moderate reaction and which is the anaphylactic reaction. To help you just differentiate between the two conditions, we've got all the signs and symptoms on one page and how to be able to identify what's mild to moderate and what is severe. So the mild to moderate reactions include swelling of the lips, the face and the eyes. There can be hives or welts and itchiness of the skin, tingling in the mouth, and abdominal pain. Signs and symptoms of anaphylaxis or the severe reaction include any one of these: difficulty in breathing, noisy breathing or stridor, which is that high-pitched wheezing noise, swelling around the lips, the tongue, and the throat, or if the patient states that they're experiencing tightness in their throat, difficulty in talking or a hoarse voice, wheezing or persistent cough. In young children, they may appear pale and floppy when displaying signs and symptoms of shock, persistent dizziness, a decreased level of consciousness or collapse, and then any abdominal pain that's associated with an insect bite or sting is indicated as an anaphylactic reaction. In order to recognize anaphylaxis, we only need one of these signs or symptoms to be present in order to recognize this as anaphylaxis and follow our treatment plan. When assessing the patient, we're going to run through our DRS ABCD. So checking for danger, check the patient's level of consciousness or responsiveness using a quick AVPU score or your GCS, send for help, assess the patient's airway by looking inside the mouth, and in particular with this patient, look for any swelling of the oral mucosa, of the tongue, and make sure that the airway is open and clear. When assessing the breathing, we're doing a quick check to assess the rate, the rhythm, and the depth. So are they breathing fast or slow? Are they breathing with a regular pattern? And are they getting a good rise and fall in their chest? If at all you suspect that there's any respiratory compromise, quickly have a listen with your stethoscope to the patient's chest to listen for any abnormal sounds. Checking the person's circulation, do a quick pulse check. We just want to feel if it's fast or slow, if it feels regular or irregular, and if it feels strong or weak. And then as we progress through our secondary assessment, that's where we'll take our vital signs. We'll do a full heart rate, a full respiratory rate, blood pressure, Check the skin color, the skin temperature, and the oxygen saturations. On our secondary assessment, or our head to toe, observe the face, the eyes, and the oral cavity for any swelling. Have a good listen to the patient's chest again, making sure you can hear those breath sounds if there's any abnormal breath sounds present. Assess the abdomen for any abdominal pain, looking for swelling over the rest of the body, hives, and rashes. And if there has been a history of an insect bite or sting, try to locate where that is in order to remove any stings that are present and take note and document where they are. When assessing the ample history, allergies is obviously very important in this case. Ask the patient if they have experienced any allergic reactions or have any allergies to any kind of substances. Find out if the patient is on any medications, in particular if they have been prescribed an Epipen or antihistamines. Ask about any other past medical history, any other medical conditions this patient may have. And again, something that's quite important to our assessment here is the last oral intake. So what did they have to eat or drink recently and the events leading up to them having this allergic reaction. In regards to our treatment, we're going to conduct our assessment and continually assess the patient throughout the management. When positioning the patient, if the patient is conscious, position them in the semi-Fowler's position, semi-seated or semi-reclined with the legs elevated. If the patient is unconscious, place them in the lateral position if they're breathing adequately. But if the patient is hypoventilating, we're going to place them supine on their back, and we would be providing those extra ventilations through our bag valve mask. In regards to oxygen, if the patient is breathing well, we're going to use an oxygen therapy mask. And if the patient is hypoventilating, we're going to be administering those intermittent positive pressure ventilations, or IPPV, through our bag valve mask. And remember, hypoventilating is a low tidal volume and a low respiratory rate. The medications we're going to provide for these patients besides oxygen therapy is the Epipen auto-injector. The Epipen auto-injector contains a single dose of adrenaline, which is used for anaphylactic reactions only. There are two types of Epipen on the market, an adult and a pediatric Epipen, which have slightly different doses of adrenaline in it. As I've mentioned, it's a single use only with a single dose of adrenaline inside. Each patient is prescribed 2 EpiPens, and if you've administered 1 EpiPen after 5 minutes, there is no change in the signs and symptoms, you can administer subsequent EpiPens until the reaction subsides. Adrenaline is the only medication that actually stops the anaphylactic reaction from occurring, whereas antihistamines, which some patients are prescribed for mild to moderate reaction, only help to reduce some of the irritating signs and symptoms of a mild to moderate reaction, but they do not have any effect on an anaphylactic reaction. Adrenaline is the only thing that can halt that. It's important that if the patient has been stung by an insect, to remove any stings to prevent further reactions from occurring. And if the patient is having breathing difficulties and wheezing, we can also administer the bronchodilator or the asthma puffer, which contains Ventolin, using the 4x4x4 method that has been explained in the asthma presentation. Constantly monitor the patient's condition, assessing the airway, breathing, and circulation, and keeping a very close eye on their vital signs, and transport these patients to hospital rapidly. So why do we use adrenaline over things such as antihistamines in the anaphylactic reaction? To answer that, we're going to have a quick look at what adrenaline actually does in the body. Adrenaline is a naturally occurring substance within the body, and when it's released, it stimulates the fight or flight reflex or response. This fight or flight response readies the body for action, so either to run for its life or to fight for its life. Some of the mechanisms that result from the adrenaline release can lead to an increase in heart rate, vasoconstriction, so the blood vessel diameter decreases. This decreases any swelling or fluid loss, and it increases the person's blood pressure. There's also bronchodilation, so the bronchial smooth muscle in the lungs dilates and opens up nice and wide to increases the airflow into and out of the lungs, making breathing easier. And there's also an increased respiratory rate to also accommodate all of these increases within the body. The Epipen autoinjector contains a synthetically formed adrenaline, and it works in the same processes within the body. So if we think about the signs and symptoms in the anaphylactic patient, they have a decreased blood pressure, they're in shock, they've got life-threatening swelling to their airway, bronchoconstriction, and decreased level of consciousness. When we administer the Epipen autoinjector, which contains the adrenaline, we increase the heart rate, cause vasoconstriction, causing an increase in blood pressure, combating the shock. There's also a halting of that fluid loss or the swelling that occurs because now the blood vessels are constricted again. The bronchi dilate, so we get increased airflow into and out of the lungs, which combats all the bronchoconstriction, and an increased respiratory rate. So overall, we're combating the shock and the hypoxia that's occurring within the body. This has a positive effect on the patient. It halts the anaphylactic reaction and improves the patient's condition. Currently, the only autoinjector containing adrenaline on the market is the Epipen. When administering the Epipen, we need to ensure that either the person is seated or supine during the procedure. This is either on the ground, or if you have a stretcher available, you can conduct this on the stretcher. Remove the Epipen from the protective casing and grab the pen, making a fist, putting your thumb over your fingers. There's a little rhyme to help us to remember which direction the Epipen goes in. Blue ends to the sky, orange to the thigh. Remove the blue safety cap off the back of the Epipen and place the orange end of the Epipen to the mid-lateral thigh. We use this area to administer the Epipen because it's got a high vascularity and a high absorption rate of the adrenaline. The Epipen can be administered over or through one thin layer of clothing, but ensure that you have cleared the patient's pockets of any obstructions and make sure you've just got one thin layer of clothing to administer the Epipen through. Press firmly until you hear a click or feel a recoil and hold in place for 3 seconds. Remove the Epipen and the orange sheath will cover over the needle, keeping yourself and the patient protected from any sharp injuries. Keep the patient seated on the ground, stretcher or supine after the procedure. The patient may require subsequent doses, so if after 5 minutes there's no change in the signs or symptoms, we can administer another Epipen. Do not allow the patient to walk even if they are feeling better, and ensure that they go to hospital for 4 hours of observation after any anaphylactic reaction. There are, as I've mentioned, 2 types of EpiPens on the market. There's the adult EpiPen and the junior EpiPen. The adult EpiPen is for any patients over 20 kgs, whereas the junior EpiPen has a dose in it that's appropriate for patients under 20 kgs. The Australian Society of Clinical Immunology and Allergy have developed action plans for recognizing allergic reactions and anaphylaxis. These are currently prescribed to patients who have got allergy and anaphylaxis and are used in the school and first aid environments. So it's quite good to familiarize yourself with these. You can have a look at how they differentiate the signs and symptoms of a mild to moderate reaction and display the signs and symptoms of the anaphylactic reaction, as well as providing the first aid procedures for managing the anaphylactic reaction. This concludes our presentation on allergy and anaphylaxis. If you have any further queries or inquiries, please don't hesitate to contact paramedical services.